Hello and welcome to GP Notebook TV. My name is Jim McMorran. I'm a GP from Coventry, but also a Cancer Research UK GP and Editor-in-Chief of GP Notebook. I'm going to talk to you today about raised platelets and cancer risk. Now, raised platelets or thrombocytosis is a relatively common finding in general practice. In fact, the most frequently used requested blood test from primary care is a full blood count where we are checking for many things, including platelets. Now, raised platelets occur in approximately 1 in 50 of the blood tests that we request on patients that we see in primary care. Now, what causes raised platelets? Well, platelets can be increased because of increased production, so a clonal mechanism such as in familial thrombocytosis or essential thrombocythemia, but these are relatively rare. The most common cause of a raised platelet count is a reactive thrombocytosis, and this can happen because of infection, injury, inflammation, but also secondary to malignancy. So what do the guidelines say? Well, the guidelines first mentioned a raised platelet count in the 2015 guidance from NICE, where they talked about the LEGO cancers. So lung cancer, endometrial cancer, gastric cancer and esophageal cancer are all associated with a raised platelet count. NICE suggested that if somebody who aged 40 or more with a raised platelet count, we should be doing a chest x-ray. If somebody is over 55, they had gastric symptoms and a raised platelet count, then this would be an indication for an endoscopy. If a lady was over 55 and had a new onset vaginal discharge and a raised platelet count, then she needs a pelvic ultrasound to exclude endometrial cancer. So has anything changed? Well, in 2019, the Scottish guidance introduced colorectal cancer as also a possible cause of a raised platelet count. So LEGO became LEGO-C. So what's the evidence for a raised platelet count being associated with cancer? Well, probably the most significant study was that of Bailey et al. From 2017 in the Royal College Journal. This looked at people with raised platelet count or a full blood count with no raised platelets who were aged 40 or more. It was found that there was a positive predictive value for cancer for raised platelets for men of 11% and for women of 6%. Also, it was noted that if there was a raised platelet count and that was the platelet count was repeated and the next reading was higher, this was even more predictive of a possible underlying cancer. The most common cancers found in this study associated with a raised platelet count were lung and colorectal cancer. In a third of cases, patients had a raised platelet count before they had any red flag or significant symptoms of their underlying lung or bowel cancer. So what does this all mean for us as GPs? Well, I think the first thing is LEGO-C. So we as GPs need to be aware that if there's an unexplained raised platelet count, that we should be thinking about lung cancer, endometrial cancer, gastric cancer, esophageal cancer and colorectal cancer. Obviously, we do full blood counts and check platelets for many reasons, and there are many causes for a raised platelet count, but we should be aware that malignancy is a possible cause. Also, if a patient has a raised platelet count, which on repeating the test is increased even further, then this is even more suggestive of a possible underlying malignancy. Well, thank you for listening to this short video about raised platelets and cancer risk. I hope you tune in shortly to hear more from GP Notebook TV.